Healthy Schools campaign always says, right? Healthy children lead to better learners. Diversity is different than equity. The goal of this work should be creating equitable access to and outcomes from school health services, right? And so that equity goal at the end requires, I think diversity is a key piece, but it really requires all the providers and practitioners and education staff to really focus on how do we provide culturally and linguistically effective services that lead to equitable outcomes. You know, our country is so diverse, and we want to have a workforce that reflects the diversity of our country, and we want our kids, our diverse kids, to see what they can do. So part of the issue is we don't see as many Black or Latinx or Indigenous providers, and so kids often don't realize they can achieve that, and quite frankly sometimes in school they're discouraged from achieving it. There's been some studies around concordance, and so the idea that if similar race provider or similar sexual orientation provider, often a patient will feel more comfortable. Now I truly think that is actually an artifact of the mistrust and distrust that the healthcare system has created. And so don't think that we should rely on that. I truly think we should make sure all providers provide culturally and linguistically effective care. But the fact that you see those outcomes show that there's this issue in the system that we really need to rectify.
What are the specific challenges or issues to diversifying the school health workforce?
We need to create educational systems that teach and support kids in attaining that goal. There is a pathway that has been stopped. We don't have enough entrance into some of the college and community college and other health professional careers because we haven't created the milieu within our educational system for kids to reach there. So that is really looking at equity within school outcomes, graduation rates, looking at some of the school discipline policies, and creating warm environments that really allow kids to feel comfortable, bring their whole selves to the table, and thrive. So kind of the first challenge is creating that initial pipeline, K through 12. The second challenge is just diversification at large. The other issue is money. It's expensive to go to health professional schools. So loan repayment is at the back end, but it doesn't get you over that initial hurdle. And so often I feel that having scholarship programs is probably a better way to think about it. And then with the scholarships, sending them back to their own community, which I think is ideal. And the last piece of the challenge is that we're often so busy focusing on the input, which is incredibly important, we ignore the fact that tons of people are leaving in the back end. And so there needs to be a deep appreciation and focus on retaining the staff we have. And particularly in schools, often school health professionals are reimbursed even lower than Medicaid professionals. So having an equitable financing structure, having incentives. Some folks are doing, signing incentives, but thinking of creative ways to get over some of those challenges. You really need to have that diversified workforce to provide culturally and linguistically effective care, but also to create programming that makes sure that you have a lot of different diverse viewpoints. The beautiful thing I think about a school health workforce is you could really create mentoring and shadowing opportunities so kids can see what the possibilities are. You're teaching them right there. You're building your own workforce while also encouraging your students. So starting now and really thinking about what kind of workforce we want and need starts with the school. They're kind of in charge for that long-term vision. And owning that and going to the tables and recognizing that is going to be important, but it has to happen with diversity, it has to happen with equity, they have to keep their data, and they have to be truly supporting the students that they're bringing through so they're ready for wherever they want to go and that they can actually thrive.